when I was 3 or 4 years old that I was sitting on the knee of an aunt, Auntie Edie, and I remember her saying very clearly to me, Graham, don't you ever grow old. She had been brought up in a generation that was afraid of age. She was brought up in an era that remembered the poor law, that remembered workhouses, that remembered cold places and damp places and hungry places where people were. A neighbour of her, called an Iron Bevan, once stood up and said, it's not poverty which is the problem, it's hunger. And so care and continuing care into old age has suddenly become a huge issue, because that Iron Bevan, attacked very, very severely by the Tory party, brought in the National Health Service. Another visionary has now brought in the idea of a National Care Service. I think we need to get one thing right. It's not the government which has come up with the idea of an £8,000 insurance policy for everybody when they retire. That's the Tory party policy. And it's only to provide care in a nursing home facility or in a hospital. It's not to provide any kind of care at home. And the decisions would be made not by your doctor or by your social worker or by you and your family. It would be made by your insurance broker. And we know what they would decide, as little as possible. We need something like the National Health Service for those who arrive at retirement and now expect, not like my Auntie Edie, to struggle along for 3 or 4 years after retirement, which is why pensions were once so affordable, because you did pay it all of your life, but it only lasted for a few years. Now you know it has to last for 10 years, 20 years, 30 years, and in some cases even more. The burden of that is actually a celebration of the success of the National Health Service. It's not a problem where we need to encourage people to go off to dignitas and take their own life because they're a burden. Age is not a burden. Age is now an opportunity to study when you didn't have a chance to before. I've got neighbours, aged neighbours, who are studying now, doing diplomas or degrees, which they could never do before because of long life learning. Others that want to travel. Others that want to keep their savings to give to their children. Under the Tory policy, that won't happen. But they tried to frighten you with the idea of a death tax. There isn't going to be a death tax. We're going to have a community of people in Britain who share the burden, as we do with the National Health Service. So poor or rich, we have the same access to continuing care when we need it, and we will share the burden of it. The burden is big, and we haven't decided yet how it will be paid. But it's not a death tax. It's living life to the max. And that's what we need to provide for everybody.
I'm going to be slightly different on this one, because I actually think that this is probably the most serious issue that is facing this country over the next 10 years. 65 years ago was the end of the war, and beyond that, people were moving into good times, and we've had quite a few babies coming in, and we're now heading into baby boomer time. There are more people heading into retirement now than ever has been. And I think this is something where we have to draw a line under party politics, where we have to say, let's stop arguing with each other. Let's actually put together a cross-party committee to work out what we're going to do with this problem. Because there are a few good ideas coming from all of the parties, but most of them aren't fully thought through yet. There's a lot of knee-jerk reaction, and I think that this is too important an issue to be arguing amongst ourselves on, that we should all get together and work together to try and sort this issue out. That's what I'm saying.
When I think about this issue, I very much think about my grandparents. My granddad went to work in Portsmouth Dockyard at the age of 14. My nana was one of 9 kids. They were brought up in a house with 2 bedrooms, and both of them had to work long and hard for everything they ever had in life. When they got married in the 1930s, they scrimped and they saved, and eventually they were able to buy a little house. And that was the house they lived in until they died. My grandfather was in hospital when he died, but my nana wasn't. My nana had a stroke and had to go into a care home. Now, because of the family pulling together, she didn't have to sell her house in order to pay for those the fees for that care home. But there are many people like her who've worked long and hard, who've done the right thing, who've scrimped and saved, put a roof over their head, and to put a little bit of money in the bank. That what will happen is this government has said to them, right, you know, to pay for your long-term care, you have to sell that home, you have nothing to leave your kids. And it's absolutely shocking. And I think that the failure of this government to deal with the long-term care issues of our pensioners is one of the most disgusting things of the last 13 years, I honestly do. And it's only now that they're coming out with solutions, and I think it's too late. We need to, as Rob said, we all need to sit down together, and it's a big issue. This £8,000 insurance is not a solution, it's a help. It means that if you take out this insurance policy with £8,000, and you don't have to take it out, when we introduce this system, anybody over the age of 65 can take it out, even if you're already in long-term care and still have your home. It will prevent people having to sell their homes that they worked long and hard for. It's the people in life that do the right thing. The people in life that haven't saved for their retirement, that haven't bought their own house, they get everything paid for free. But it's always, to me, the people in life that do the right thing, that work hard, that have to suffer. And these people, there are 48,000 people currently in care that have had to pay for their homes to be there. And I think that that's disgusting and it shouldn't happen. So this £8,000 insurance is something that people can take out at 65, or for a limited period they can take it out if they're older than 65, and it will protect them. So that if they do need that care, like my grandmother did, they will be able to tap into it, safe in the knowledge that that care will be provided for. Unlike the Labour policy, which means as soon as they've passed away, their estate will be raped with anything between £12,000 to £50,000 to pay for their long-term care. And with regard to my Liberal Democrat colleague, I'm very grateful for your idea of all working together, but all I would say is your party want to join us further and further into Europe. It's hideously expensive. We waste millions of pounds, billions of pounds every year on Europe, and that is money that we could be spending on protecting our older people for the future. And I think that that's what we should be doing, not wasting our money on our European partners.